Sudafed preparation and pain tablets are an over-the-counter medication formulated to provide relief from symptoms associated with sinus congestion, sinus pressure, and headache. It contains two active ingredients: phenylephrine hydrochloride, a nasal decongestant, and acetaminophen, a pain reliever and fever reducer. Indications: Sudafed preparation and pain tablets are indicated for the temporary relief of the following symptoms: nasal congestion due to the common cold, hay fever, and other upper respiratory allergies, sinus congestion and pressure, headache. How to use: Sudafed preparation and pain tablets are taken orally with a full glass of water. They can be taken with or without food, but it is recommended to take them with food or milk to minimize gastrointestinal irritation. The dosage of Sudafed preparation and pain tablets is individualized based on age, weight, and severity of symptoms. Adults and children 12 years and older take 2 tablets every 4 to 6 hours as needed, not to exceed 8 tablets in 24 hours. Children under 12 years consult a healthcare provider for appropriate dosage instructions. Contraindications: Sudafed preparation and pain tablets are contraindicated in individuals with hypersensitivity or allergy to phenylephrine, acetaminophen, or any components of the formulation, severe hypertension or coronary artery disease, use of monoamine oxidase inhibitors within the past 14 days. Special instructions: Sudafed preparation and pain tablets are intended for short-term use to relieve acute symptoms. Prolonged use should be avoided without consulting a healthcare provider. Patients should avoid consuming alcohol while taking Sudafed preparation and pain tablets, as it may increase the risk of liver damage and central nervous system depression. Patients should be cautious not to exceed the maximum daily dose of acetaminophen from all sources to avoid the risk of liver toxicity. Side effects: Common side effects of Sudafed preparation and pain tablets may include nervousness, dizziness, headache, nausea, insomnia, increased heart rate. Serious side effects such as severe allergic reactions, elevated blood pressure, and liver toxicity are rare but can occur. Patients should seek medical attention if they experience any unexpected or severe side effects.